How long does behavior therapy take? This is a common question that I receive from my clients in my work as a certified dog behavior consultant specializing in aggressive behavior and nervous system dysregulation. And the answer, of course, is it depends. But the factors that it depends on might surprise you. So my client population is exclusively dogs who are dysregulated and or dogs displaying aggressive behaviors. I would say that the percentage of my clients who are not dysregulated, but who are engaging in aggressive behaviors is very, very small. Most of my clients are dysregulated and may be engaging in aggressive behaviors as part of that. I do sometimes work with dogs who are not dysregulated, but are displaying aggressive behaviors, but that is less common for me in my client population. So mostly what I'm talking about in this conversation is dogs who are dysregulated. And dysregulated dogs have complex behavior needs. We are not looking generally at one behavior concern. And really underneath the behavior concerns, what we're actually looking at are stressors. And so another way to put that is that dysregulated dogs are not dealing with a singular stressor, or even a singular context or environment where they are dealing with stress. Dysregulated dogs have higher than ideal baseline stress levels and often struggle with resilience to stress and struggle with accessing self-regulatory skills to bring themselves down from stress. And so if we're looking at the big list of common behavior concerns that we might see, family-directed aggression, intra-household aggression, both of which can have subcategories of things like conflict aggression or resource guarding, or fear of other dogs or fear of people or a certain person in the home. We might be looking at handling concerns, noise phobias, separation anxiety or separation-related distress, hyperattachment, fear-based aggression or big stress responses due to fear of people, other animals, loud noises, trucks, wheeled items, things that are out of place. We might be looking at a dog who has trouble settling, getting enough sleep, getting enough rest. We might have a dog who's engaging in compulsive behaviors. We might have a dog who really struggles with anything being out of their routine or who struggles with novelty. And in my cases with dysregulated dogs, it's not one of those things. It's often multiple of those things, sometimes all of those things. And so that in itself is a factor when we're talking about complex behavior cases versus maybe a dog who is their whole thing is that they're reactive on walks, or their whole thing is that they have a noise aversion, or they have a fear of a particular stimuli. Because with complex behavior concerns, all of these stressors are related. And so a lot of times we as the humans pick up on the ones that are dangerous, unsafe, the ones that are causing the most overt distress in our dog. But we need to look at all of them because they're all feeding into each other. So one of the factors then that we can consider is how easy these stressors are to manage. The better management we have in place, the better, faster progress we will make. And that is because without good management, we're seeing negative associations strengthen. We're seeing stress levels stay higher. We're seeing reinforcement of the survival skills that the dog is practicing. And so we're working against ourselves. And that's why management is the first and potentially most important aspect in a behavior case. And it will cut down the time that we would otherwise spend in behavior therapy. But some behaviors are very, very difficult or even impossible to manage completely or to manage well. I would say it's normal to not be able to manage 100% perfection. But in some cases, we are not able to get very good management at all. Due to various factors. That's why working with a behavior consultant can be really helpful, because it's my job to get really creative and imaginative about that. But even so, depending on what is going on with the dog and the environment and the resources available, sometimes it is very challenging. So in those cases where management is poor, we may be spending a considerably longer amount of time in behavior therapy. Access to those resources, that is another piece. So are you able to access a veterinarian who is savvy with behavior meds? a veterinary behaviorist or just a general practitioner who is savvy with such things? Are you able to access a veterinarian who is able to appropriately investigate underlying and comorbid health issues? We know that up to 80% of behavior cases involve pain, either directly or indirectly. Being able to find that, knowing that we're usually not going to find that in a typical basic exam, being able to find that is huge, and that can really impact our ability to make faster progress. Knowing that if we are dealing with a chronic health condition, especially if it is not well managed, we may spend more time. So if you have a dog who is dealing with really bad allergies and you don't geographically or financially have access to support that can help get that under control, it is going to take longer to see progress. And this is why physical health is one of the first things that we always check out in behavior cases. And it's so important to know we can't rule out pain. We can't rule out health issues. And most of these things are not found upon like a traditional examination. Usually by the time we're seeing more overt signs like decreased mobility in the body, overt GI symptoms, limping, that sort of thing, we're well past the point of where the pain has started. Those behavior symptoms, escalation or onset of those behavior symptoms, are often our first signs. Social support as a resource is also a huge factor. And so when the family is supportive, the people living in the house, when the neighbors are supportive, when roommates are supportive, when your friends and extended family are supportive, it can make a huge difference. It can make a huge difference in the human's emotional cup, their capacity to keep going. It can make a huge difference in the sustainability of the work. It can make a huge difference in the ability to manage the behaviors, which we talked about, is so important. And so that social support as a resource is a huge one that we don't talk about often enough. Another factor is, what is the human getting out of the behavior therapy? And how much support does the human need in continuing along in the behavior therapy? And I see a wide range of this, and these are sort of two pieces. So sometimes I work with clients who are like mini behavior consultants in a case study of one. They have become very behavior savvy, and they are really just in need of a bit of direction. They really need someone who can get into some of these nuances with them, and then they're able to take it and run with it. And those may be folks that I see less often, like less frequently, and or for a shorter period of time. Versus if I'm working with someone who does not have that understanding and may not have the capacity, the interest, the time to really understand at that nuanced of a level, they may need support for longer and more frequent sessions. And I would say that's more like the average. That's sort of the norm, right, for most pet parents. But then you might also have folks who are struggling to get these concepts, struggling to identify body language warning signs, struggling to generalize these concepts for a myriad of reasons. And they may also need longer support, additional support, a higher frequency of sessions, etc. And then we may also have situations where sometimes clients want to keep going just because they really appreciate the accountability of regular sessions. They feel better, they feel safer having a second set of eyes in their setup. And so it's less that they maybe need more support in that sort of sense, as much as it's really mentally, emotionally, logistically beneficial to them to keep going. Another factor too, and this is kind of like management, but also kind of not, is sort of some of the other factors that we have to control for. So in multi-dog households, we might see that we also need to support the other dog in order to support the first dog. And so that may mean that we're spending more time in behavior therapy. So there can sort of be these exacerbating pieces too that we may not initially consider. And it is the sort of thing where I think as long as you're matched with an appropriate professional, something can be a lot better than nothing. There can be a lot to be gained out of just getting a better understanding of what's happening and where management needs to be put into place and what type of enrichment is appropriate. So even if committing to behavior therapy doesn't feel accessible at the moment, just dipping a toe in can be really great.